Hey, welcome to Common Sense USA. This is Joe again. Quick update for you. Seems like the CDC website has made some changes. The reason for these changes are very simple. Colorado State has been notifying the public that they made some errors. One of the errors is, if you go over here to the actual, whoops, let's get you out of view. Seems like nearly a quarter of the people in Colorado said died from coronavirus didn't have COVID-19 or death certificates. There's a reason for this. What had happened was they were going by the CDC guidelines of how this happens. And you're supposed to mark, guess, the cause of death if it's contributed to or was a direct cause of COVID. Problem with that is that's not been happening. And the reason why is because the CDC got themselves in a little bit of trouble. What had happened was is that due to Colorado's health departments, and this is just, why my computer's so slow today, it is driving me nuts, is we're going to go to Washington here. Right here, Colorado health officials revised the way they count deaths from the coronavirus to include only patients with death certificates list the cause as COVID-19. Problem with that was, on the website, if you remember and watched my previous video, it explained how to write down or fill out death certificates. That came in a PDF file. It's right here. It's one of these files right here. Well, now the CDC website makes it very simple in large print. One of the issues they're having is, it says right here, and they do this now because people were discovering it and it was too late. It was out there. Common sense was, hey, yes, we did say this. This is the rule. Now they're told to make sure that it's in plain view of, if you remember, anything from the fine print on everything you read on products you buy and so forth. Well, their version of PDF files was their fine print. Well, it's out. Basically, this is what it is. COVID deaths are identified using the code, which I explained this in my last video. But what's getting down to it is, and I'm going to read here, is any deaths they're identifying. This can include cases with or without laboratory confirmation. Well, ever since the Colorado incident where the deaths were not being reported properly because they were counting people that were even listed on there as having COVID. Well, CDC is now back in a little bind. And my computer is really slow right now. It's a little slow. Sorry about that. Well, let's go back to here. It says this can include cases without laboratory confirmation. Now check this out down below about how to understand cause of deaths from death certificates. How does a death certificate work? And in bold lettering, check this out. COVID-19 should not be reported on death certificates if it did not cause or contribute to the death. Here's the contradiction of this whole thing. They're telling you not to put down on the death certificate if it's not the cause. Basically because what happened in Colorado, like I said, you see it right here, died from coronavirus and didn't have it on the death certificate. That's why it's put there now. That's why they updated their website. While in the process of updating the website, somebody didn't proofread everything because you're putting down, don't put this on the death certificate, it wasn't caused or contributed to the death. But up here, they're saying, but it's okay to put it down, even if it doesn't include with or without laboratory confirmation. It can include. I mean, it makes no sense. Why? This is why we're having problems. This is why the numbers are so high, and it's really ridiculous. Here's the update. So on the website now, when you go looking for, if you looked at my old, go back and look at my first video on this, and you're gonna see the same thing, but they changed. One of the things they changed is they threw this in here. They decided to throw Mr. Little. Was gonna throw a new graph in here to really confuse everybody. And if you notice, they only have the cost direct of deaths based on total deaths on these dates. actual total deaths total. Well, of course, you can see down here, it's Microsoft. Oh, of course not. Well, here's the thing. I told you in my first video, they don't have any control over the numbers. They don't, but they can throw any damn graphs up here that confuse the hell out of you. Well, unfortunately, they still have to do this one by the dates. And this was updated on the 15th, which was a Friday. And to prove that this is how accurate this is here's the count of, it's only actually 60,299. But Joe, it says over here in cases, there's 87,000. If you watched my first video, I explained that. I'll explain it again. They're taking this number and they're adding this number when it has to do with, excuse me, excuse me, folks. If there was pneumonia and COVID together in the deaths, because they can't determine if somebody had pneumonia first and then got the COVID, or did they have the COVID first and got pneumonia. I'm going to sneeze again. I know I am. So that's where this number is coming from, because they're adding this to this. But as you can see, pneumonia by itself is still top. It's on top, and we're not hearing this. It's not in the news, and it's getting to the point where I've actually been doing these videos and copy them and send them to a lot of the social websites, because it needs to get out there. And I need your help, people, to share this video, because people need to know actual pneumonias is still higher than COVID. And it's going to be. Matter of fact, right now on the drop line. Now, if you watch my previous video, you would notice that this number right here was actually at 3,000 or 2,000 or 3,000, and now it's the actual number is 2,464. And yes, this says 5.9, but if you remember my video, they update this after their certain week ended. There's your 7-day wait. What's this video about? Well, CDC had to update the web page because of what happened in Colorado, and they're trying to basically say, you know, they're putting in everything they possibly can to avoid their responsibility for misleading the public, misleading the health departments, misleading the states. And this is one of the reasons why the government of the United States, federal government, is not even relying on their data anymore, because they got too many of this. It includes cases with or without laboratory confirmation. How can you put somebody down for dead if you don't have that laboratory confirmation? So this is what I'm doing. I'm updating you what's going on. And just to verify one more thing too, just so you're aware of, and I'm going to find it for you right now, is there's the deaths in New York City, 15,444, and they have a possible 5,000. And if you remember from my previous video, again, this is New York's probability numbers. Well, today's update, or actually yesterday's update, actually went down. Now it's only at 4,000, so you're still over 20,000. But this was, that number right there, sorry, this number right here was actually at 5,000 when I did my last video. It dropped, which is a good thing. That means you're taking more cautious of the state. But again, these are confirmed deaths at 15,000. But you got to remember, those are confirmed deaths that include with or without laboratory confirmation. And that's sad, because out of this, there could be, that number could be in half. And the same thing for the total U.S. number of deaths. It could be half. Total number of cases. We're having issues with this because what happened with them on the Colorado incidents, where they put this disclaimer in, which I already showed you. Whoops, wrong. Understanding how everything works. Right here, where they say do not report it, and then they go up here and they say, yeah, by the way, you know, we're going to count COVID deaths even if it doesn't have laboratory confirmation. So that all said, the cases haven't been actually updated as much as they should. They're on top of the deaths, but remember, those deaths are still based on with or without confirmation of a laboratory. It's still irresponsible to do that. New York City's still on top. As we go down, the numbers are dropping based on the states and cities and so forth. There is a new thing they also put on here too. Um, and one of it, this is kind of on the website they just put on as of today, actually, on the Saturday the 16th. And that was this. And I'm going to go up to here. I'm going to go real slow so you don't know. When you get on this website, and if you just go, now I'm going to start fresh right here just to show you. If you go cdc.gov, okay, what you're going to do is, as soon as you get to the website, oh my god, why is it taking so slow tonight? You're going to go right to here, learn more, okay? Click on that. That's what you want. You're going to get this page right here. What you want to do is, you can do the data surveillance, which also brings you back to this, or vice versa. Get the cases in the United States first. You'll get the page I've been showing you. Down below, and this is something they added in, was they got the cases by deaths, cases and deaths by county. Okay, you select your state, go to New York. Hello, where are you, New York? Okay, view county data, and this is where it gets a little bit complicated, but it will tell you by the counties, case by county. Now, 1, 2, 3, 4, 5. These top 5 right here are the 5 boroughs of New York City. Cases per 100,000, deaths per 100,000. Okay, and then the rest of this is New York. Okay, the reason I'm bringing you to this page is what you can do now on this, which is pretty. I think it's pretty. If you can actually go like that and just go over where you want to go. And you can actually see, percent of states' cases not calculated. Total cases is less than 20. That's a good thing. I like that. And that's total number of cases. That helps us. Now, if you go to total deaths, if you look, excess has got 32. We got less than 20 cases, and total cases 20. Total deaths is 0. Sorry. Total deaths is 0. St. Lawrence County has less than 20. Clinton's got less than 20. And then Hamilton. So between Franklin and Essex alone, we have 0. This is good data to know based on what they're doing. And I wanted to show you, especially to people in my area where I live, they understand what's going on. That was one of the things I wanted to show you. What's disturbing is the case data list I used to go by. Compare the actual cases I've shown you in the past. It's not there anymore like it used to be. It's kind of sad too because it was more detailed. And if you want to know what I'm saying, is I explained it in my last video. They did some changes because people are starting to realize, hey, we know how to add, 1 + 1 = 2. And hey, my machine, this thing's just running really slow tonight. It must not like me, or it must not like the CDC. I've been on the website for so much. The data I was talking about is this one right here. This page is no longer there. This page is this one right here. Last video I said why, because it actually, you can see the actual real numbers. Like I said, CDC can't control the numbers. They can't say what they have. They can just change the graphs, and they can put their own graphs up and break down the numbers, but they can't actually change the actual numbers, make them higher or lower. The only way they can make them higher or lower on their main page is by adding other numbers to it, which I've shown you. So, new cases by days here. But what I did discover is, and they still haven't updated, is if you look here, and I don't know why they're doing this, is they're updating the cases, same time they're updating the total deaths, but for some reason, down here, they're not doing it down here. I went and looked. That's got the 15th view by date, but it's not giving me the full total of cases. It used to right here. It's sad that they're doing it this way. You get the number of cases here. If you add these totals, you're going to get this number here. This number is off. I'm gonna be honest with you right now. That's the same number it was for my last video. It's gone up almost just over 30,000 cases, but it's still off by 300,000 compared to that right there. And it's, I wish they would, update this, but because people I think are catching on this too, how this actually works. So basically, what this video was the update of CDC, the update of the website. You don't have to fish so much around, but at the same time, they have to make it clear now what is included and not included. I still can't get over this one. It's sad that they are including without laboratory confirmation. I don't understand that logic, and then they come back down to here and say it should not be reported on death certificate if it did not cause or contribute to death. Well, that's the sad thing. How do they know if it contributed to it or not? If they allow, we can put down the cause of it. I mean, it's what's the word I'm looking for? Oxymoron. I mean, seriously. I mean, if somebody can explain this one to me, I would really like to know how that works. I mean, you would need a laboratory confirmation to say somebody died of cancer. You would need a laboratory confirmation if somebody died of a certain, allergy to a certain food. Why wouldn't they do that for this? Is beyond me. It doesn't make sense. So, thank you again for watching the video. I'm going to keep you updated as best I can. The number one thing is please share this. Share this with everybody you can. More people get educated, the more they're going to question their own local governments to say, hey, we need real numbers. We need the actual numbers. And once again, remember, please do stay safe. And, oh, one more thing before I forget. Yes, do stay safe. But somebody did ask me, actually privately messaged me about something. About the deaths comparison regarding COVID and pneumonia. And it was a good question. I did not cover in my first video, so I'm going to cover it real quick right now. Pneumonia is contagious. I'm going to say it again. It is contagious. I did some research on this and how this works, and it's actually in my. I already got it up here. Contagious about pneumonia, even on the CDC website. But here, when is pneumonia contagious? Pneumonia is contagious when the causative pathogens, usually bacteria or viruses, are expelled by an infected person by coughing out infected droplets. These expelled droplets contain the bacteria. Now, mind you, bacteria or virus that causes pneumonia. There are bacteria that causes pneumonia, and I think that's one of the issues is that some of these people, and this opinion now, just strict opinion, is bacteria could be showing up as COVID in the testing, and maybe they haven't looked at that yet. Maybe they should, but pneumonia is actually contagious without a virus because it could be a bacteria infection. So yes, pneumonia is contagious. The CDC actually has it on their website regarding pneumonia because they actually have it. If I remember, I think I did it like this, real quick. Yep. They actually have an actual web just specifically for pneumonia and how it can be contagious. And it's right here. Pneumonia is an infection of the lungs, and this is how they call it. They call it as an infection. And I'm kind of confused why they're not treating these infections with antibiotics, even when they have COVID. But who knows? I'm not a doctor. So some patients with coronavirus diseases have had, and they're saying some patients. This is another thing too, right here. So I'm going to highlight this in case you don't see it. Some patients with corona disease, COVID-19, have had pneumonia. But the thing is, they said some. They're not saying percentage, which is, I don't know, maybe a way of them protecting themselves. But it says right here, pneumonia is an infection of the lungs that can cause mild to severe illnesses in people of all ages. Vaccines can prevent some types of pneumonia. You can also help prevent it, and it goes on about hygiene and so forth. Lower risk of pneumonia. It tells you about, don't smoke and stuff like that, which is, it's a good thing. We all should, causes pneumonia. Now, this gets a little bit more technical, but to the person that did text me this or message me, I'm sorry I didn't answer this in the first video. Here you go. I keep doing this because I got a runny nose. Allergies, nothing else. I've just got allergies. It says right here, viruses, bacteria, and fungi, which is something I didn't know either, can all cause pneumonia. In the United States, common causes of viral pneumonia are influenza, which is flu, and respiratory syncytial viruses, RSV. A common cause of bacterial pneumonia is Streptococcus pneumonia. However, clinicians are not always available. If I'm saying that wrong, excuse me. I don't have my glasses on. Find out what germ caused someone to get somewhat sick, and just you can go to the website. So here's the answer: yes, it is. It is contagious. So again, thank you very much. I know this is a short video. I was trying to make it as short as I possibly can. And remember, here are your actual deaths, the actual true deaths of COVID without pneumonia. This is, people that have, emphysema, lung disease, poor health, with cases, of course, of some people that are actually in good health that have died from it. I wish they would break down that factor, but the higher number of cases is based on their age, which is another thing too. I admit is not here. I just noticed that too. Is they used to have it right here, the age factor, and it's not there this time. They took it off for some reason. I don't know why. When I find out if they put it back on, maybe they're updating and maybe it's not there. And again, this is updated as of Friday. Here are the numbers. Here is the, you just remember, I'll add that with this number here. That gives you this number. And again, like I said, they shouldn't be doing that. They should be showing just this number, because when you add this number to this to make it a fair true data, this number here will also be added to here, because there is pneumonia by itself. And there's your update. Again, thank you very much for listening. Please share with your friends. Have a good day, and be safe, everybody.